Welcome back to another edition of the Hart2Heart Podcast. And today I'm going to be doing a solo podcast on testosterone. So I'm going to be talking to you about what testosterone is, why you should care about it, why you may have symptoms of low testosterone, how to correct those low symptoms, and all your questions that you posted online related to testosterone. So let's get started. So first of all, what is testosterone? So testosterone is the main male hormone, but it's also a female hormone. So a lot of women don't understand and don't know that there's actually more testosterone in females than there is estrogen. So what I'm saying here is I'm not saying that estrogen is still not the dominant hormone for women, but what I am saying is that milligram for milligram, women actually do have more testosterone in their bodies than estrogen. So absolutely, testosterone is critical for women's health. So what are the symptoms of low testosterone and why should you care about it? So one of the big symptoms of low testosterone is low sex drive or low libido. Another symptom is low motivation, low energy, and also depression. And I've posted about this before several times. There's lots of randomized control trials and meta-analysis that indicate that men who have low testosterone do experience more symptoms of depression. So if you are a man who's struggling with mental health, particularly you have low energy, low motivation, low sex drive, looking into getting your testosterone checked is something that you should do. And we're going to go over those blood tests just in a minute. But some other symptoms of low testosterone can also include not sleeping well at night. It can also include not being able to drop any body fat or having a lot of difficulty just improving your body composition and adding any muscle. Because we do know, obviously, that testosterone is partly responsible for adding muscle. So there's a lot of reasons why you would want to correct low testosterone if you do have it, whether you are a man or a woman. So moving on to what blood tests should we order? So, this is a very good question, and it's something that needs to be discussed in detail because sometimes it can get a little bit tricky, and sometimes not all the best blood tests are ordered. So, what are the best ones to order? So first of all, you need a total testosterone and you need a free testosterone. So there's a big difference between a total testosterone and a free testosterone. So your total is obviously the total amount of testosterone that you have in your body. Your free testosterone is the amount that's actually in your cells that's actually going to be doing the things that you want to do, like improving your sex drive, improving your motivation, improving your energy. That's all going to come from the free testosterone. When testosterone is bound up, so when you have something called a high SHBG and you have high total testosterone, what sometimes happens is that all that testosterone gets tied up into your SHBG, which is sex hormone binding globulin. So what happens then is that you have high total testosterone, but you have low free testosterone because your SHBG is just taking up all of that testosterone. It's bounding it. So only about 0.5% to about 2% of testosterone is actually free. The rest of it is bound. So what you want is a high total free testosterone. Okay, if you have, again, a high total testosterone but a low free, then that's not good. That essentially means that you have low testosterone. Okay, so free testosterone is the one that you really want to check. So, getting your SHBG checked is something that's, good because it can, in fact, tell you if you are going to be binding up a lot of that testosterone. Okay, so make sure you get your total testosterone and your free testosterone checked when you're doing your blood tests. In addition to that, there's a couple other things that you definitely want to check as well. So you want to get a CBC done. Okay, a CBC is going to tell you whether or not you have a high hematocrit or high hemoglobin. The one danger about being on testosterone, particularly if you're taking higher amounts, is that it can increase the thickness of your blood, which can cause a heart attack or a stroke. Again, this is not very common. I've been prescribing testosterone for just about over 10 years. I think there was one guy I had to take off just because when I put on it, his hematocrit and hemoglobin just went up too high where I couldn't do anything to get it down. Now, is there something you can do if that happens? Yes, you can give blood or do bloodletting. A lot of people do this anyway. There's a lot of research out now about having, not too low, but lower-ish ferritin or iron levels. And, if you do bloodletting, obviously you're going to lower your iron levels. But the other benefit is that if you do have high hemoglobin, hematocrit, thickening your blood, then by doing bloodletting, by giving blood, you can in fact reduce that. So something to kind of keep in mind. Another test you should get is a PSA. So, you do want to make sure that your prostate is in good health when you are taking testosterone. Yes, a lot of the reports are overblown on testosterone, causing cancer and all that kind of thing. I think that's been debunked quite a bit. But at the same time, you definitely want to be safe. You definitely want to get your PSA checked when you are taking testosterone. Initially you want to do it right away. Then I do it at 3 months. I do it at 6 months and a year. And then I do it at least every year after that. So you want to be really careful about doing that. A couple other, blood tests I think you should do while you're taking testosterone as well is you would definitely want to get your estradiol checked, so your estrogen. So if you take too much testosterone, unfortunately that can get converted into estrogen. And this is what's known as gynecomastia. Or, if you're in the bodybuilding community, people will call them, bitch tits. So basically what they're saying there is that if you take too much testosterone, it gets converted to estrogen, then you are going to be increasing your estrogen levels and potentially could have side effects of too much estrogen. So what are those? Bloating and headache, feeling just unwell. Those are kind of the bigger symptoms that you'll see initially. But unfortunately, if it does go on too long, you can get gynecomastia, or growth of some of the breast tissue. And again, this is often called bitch tits in the bodybuilding community. So, definitely don't want to take too much testosterone, and make sure that your estrogen is in check when you are taking testosterone. Other things that you want to check when you're taking testosterone for your general health as well, you definitely want to get a hemoglobin A1C done. So this is going to be a measurement of your blood sugar over 3 months. It's a fantastic test. So, much better than a fasting glucose in my opinion, because again, it's a measurement over 3 months as opposed to just one single measurement. Testosterone has actually been shown to improve blood sugar control overall. So, if you are a diabetic and you have low testosterone, taking testosterone can dramatically improve your diabetes, your blood sugar control, and your overall metabolic health. So, definitely something to consider. And always definitely want to check your kidneys. You definitely want to check your liver. Make sure that those things are not affected by your testosterone levels as well. Again, very, very rare, but you definitely do want to make sure that those things are not being altered negatively when you are, or if you are going to take testosterone. There are some other blood tests that I would suggest as well getting that would assess your cardiovascular risk in addition to your testosterone hormone levels. So, a couple tests that I think you should definitely be getting are your ApoB, which is basically just a little bit better of a test than getting your LDL. So I'm not saying you shouldn't get a lipid panel done. You absolutely should be getting a total lipid panel done, which will include your triglycerides, your HDL, your LDL, and your total cholesterol. So definitely get that done. But in addition to that, what you do want to look at getting done are some other things to assess your cardiovascular risk factors while you're taking testosterone. So I would do an ApoB as one. Another couple tests that I think are important, there's an NMR test. So what that does is it detects your particle size. So if you have large particles, they do not seem to be too atherogenic, so they're not going to cause heart disease. If you have smaller lipid particle size, they seem to be associated with being very, very pro-atherogenic, so they will contribute to to heart disease. So something to consider as well. Another test you can also get is an oxidized LDL. So as we know, LDL has been, I know this is a little bit controversial. Some people are Peter Attia fans. Some people, didn't like his approach on longevity when he was talking about cholesterol and LDL. I do agree that there's certainly a lot of different cardiovascular parameters that we need to assess. Clearly, I just mentioned a few then. I still do believe that there is some validity to LDL, but I do think that an ApoB is in fact a better overall test than an LDL. And then on that note too, when you are looking at your lipid panel, which has your triglycerides and it has your HDL there, that's a very good ratio for looking at your insulin resistance. So your triglyceride to HDL ratio, and you want to have, basically as high as HDL to triglyceride ratio as you can. So your higher your HDL to your triglycerides essentially indicates less insulin resistance. And I've seen one study anyways that showed that people who had a better insulin resistance but a worse lipid panel actually had better outcomes than people who had a worse insulin resistance and a better lipid panel. So, it may in fact be true that your total triglyceride to HDL ratio is more important than some of the other cardiovascular parameters that we're looking at. One thing too, I know I'm going kind of hard into the cardiovascular side here right now, just because I do think this is important to look at, whether you're on testosterone or not. But LP little a is what we call. You can just do it one time because it doesn't seem to change too much. Unfortunately, whether or not you're using drugs or not using drugs, if you do have high or low LP little a, and this has been shown again to be associated with cardiovascular disease. So high LP little a just puts you more at risk. Again, just the more information you can get on your overall risk is the better. Again, I'm not trying to overwhelm anyone here, but there are several different tests you can get, and I do think that having the most complete picture is the best way to go. And so, getting all those tests done, I think is very, very important. So that's mostly the main things that you should get for your blood tests. There's a couple other things that you may want to order as well. So I mentioned DHT earlier. DHT is dihydrotestosterone. Often sort of gets a little bit of a bad rap because it is associated with prostate cancer and with male pattern hair loss. So, the other thing about DHT though is that it's actually a very powerful hormone for your sex drive, for making you feel good, for giving you energy. So you don't want to crush your DHT. And although I wasn't going to chat too much about this today, that is what finasteride or Propecia does essentially. It's a 5-alpha reductase inhibitor. So it's going to inhibit that conversion from testosterone to DHT. So, you will have lower DHT when you are taking finasteride or Propecia. So you likely will have, less hair loss, but you also may be getting some side effects like low libido, low motivation, low energy, depression. There's also something called post-finasteride syndrome, something that I won't go down on today, but if you are looking for some information on that subject, Dr. Kyle Gillette, who's been a wonderful resource of information on the internet over the last few years. He's been on my podcast, he's been on Andrew Huberman a couple times. He's actually done some posts on this, so if you want to go check him out, I think he'd be a great resource if you're looking for some more information on a post-finasteride syndrome. But again, just coming back to some of the blood tests, again, DHT is something that I do think that you should be getting checked. Another thing too that you should be getting checked is vitamin D. So this is particularly important for people if they are looking to increase their testosterone naturally, but even if you're not looking to increase it naturally, but if you do have low vitamin D, that in fact is linked to low testosterone. So, if you have normal vitamin D and you take vitamin D, the likelihood of your testosterone increasing is actually very, very minimal. But if you do have low vitamin D and you take vitamin D, that can increase your testosterone. So, for that reason, I think you should definitely get that test, but you should get that test done anyway, because you want to make sure that you're always in the optimal range for vitamin D, just because it's so important for so many different things. Maintenance of your hormones, like we're obviously talking about now, but also your bones, your teeth. It's a critically important hormone. It's also been linked to depression if it's low as well. Again, taking super physiological doses and getting your levels way beyond the normal limit, it's not going to increase your testosterone or your mood beyond that. Again, what we're just looking for is normal levels. Other things you can also look at too, zinc is something that I've talked about before. Again, it's kind of similar in that regard, because when you have low zinc, then when you take zinc, you can in fact increase your testosterone levels. Again, if you have normal levels of zinc and you start taking more zinc, the chances of you increasing your testosterone level further are basically insignificant to none. So again, we're just trying to get into the optimal range. But again, another good test to order if you're introducing something to try to get those levels up. And just like the vitamin D, you should have good levels of zinc anyway, whether you are or are not on testosterone. We know how important zinc is for several different things, just like our immune system. And so you want to make sure that you have an optimal level of zinc as well. Definitely not necessary, and unfortunately an extremely expensive test to order in Canada is an IGF-1. So what is an IGF-1? IGF-1 is basically the best test we have to determine your human growth hormone levels. So, I recognize that obviously testosterone and human growth hormone are completely different hormones, but there is some evidence to suggest that when you increase your testosterone, you can in fact increase your growth hormone as well, and vice versa. So because of that, I think that having an IGF-1 test is something that's reasonable to do. Again, I know it's very, very expensive to do in Canada, so just do it if you feel it's necessary or if you're making changes. But if you feel that it's something that you can't afford, obviously you can still get some really great tests done for free in Canada and make some really good decisions based upon that to improve your health. So all is not lost. So I think that covers most of the blood tests that I generally order. Sometimes there's a prolactin test that I'll order as well. That can give me a little bit more information. But those are more the main tests that I cover when I'm ordering testosterone for men. Some people may ask about DHEA. DHEA, is something that you can order as well. It'll give you a little bit more of a complete picture. Again, not really necessary though per se, but the ones that I highlighted at the beginning, those are definitely the ones that you want to get. So just again to kind of summarize, like you definitely want to get a total testosterone, free testosterone, estradiol done, CBC, hemoglobin A1C, a fasting sugar, EGFR, kidneys, get an ALT and SST, check your liver enzymes, SHBG, also very important. So make sure that you are including those tests when you are seeking treatment or medical treatment for testosterone. So, a lot of people, when they have low testosterone, they don't want to jump into taking a prescription medication. They don't want to jump into taking a cream. They don't want to jump into taking a gel or an injection. They just want to do something naturally. And I totally get that. And that's the way that you should start doing it. If you can not use any prescriptions or not use any testosterone, which is a prescription to get your testosterone up, then that would be ideal. Now, unfortunately, that's not helpful for everyone. It is for some people, but what I mean by that is that some people are able to get their testosterone up naturally using behavioral methods and supplements. Some people, unfortunately, just are not able to get it up to a desirable level, even with the use of supplements and some behavioral methods. So I'm going to go over some of those now, and basically just going to be reading an old Instagram post or a pinned Instagram post that I have put up maybe in the last month or two. September 12th, I think I did it. So these are some methods you can use to increase your testosterone levels without the use of drugs. And so, one of the first things I have here is sleeping 7 to 8 hours a night. If you don't sleep well, your testosterone absolutely will suffer. So guys who sleep less than guys who sleep more are going to have lower testosterone levels. Like particularly when you're getting into that less than 4 to 5 hour range per night, your testosterone levels are absolutely going to suffer, and so are your human growth hormone levels. If you're not waking up with an erection or morning wood in the morning, these are symptoms again of low testosterone, and you are more likely to have more testosterone when you're sleeping 7 to 8 hours a night. And you may find that, when you're getting 7 to 8 hours a night, you are waking up with an erection, but when you're only getting, 3 to 5 hours a night, you're not. So, the proof is in the pudding there. Another thing that you can do is weight train. So particularly when you're using heavy movement, heavy compounded movement, so things like deadlifts, squats, bench press. Obviously, you want to do these things, safely. I've had my own, back issues with deadlifts in the past, but you want to do these things safely. But you do want to lift heavy because that is what's going to drive your testosterone up. So absolutely weightlifting is going to be helpful. And again, I know I've sort of focused this whole discussion a little bit on men, but everything that I'm saying absolutely applies to women too. Like I said at the beginning of the podcast, women have milligram for milligram more testosterone than estrogen in their bodies. They will also get the same symptoms of low testosterone, whether it's low motivation or low sex drive or just feeling unwell. So, this podcast is absolutely for women, and all these things that I'm saying here apply to women just as they do to men. Other things that you want to avoid are plastics and endocrine disruptors. So, things like BPA and things that are wrapped in plastic. So, I use a lot of Tupperware. I use a lot of glass just because, that is better, to have glass Tupperware as opposed to, plastics. And endocrine disruptors, they're kind of everywhere. It is difficult to avoid them. I do recognize that, absolutely. But, trying to avoid things like BPA, again, like I had Dr. Stephanie Estima on here recently. She was talking about when you go to Starbucks, like take that plastic lid off. It's a big endocrine disruptor. So, just do what you can to, avoid plastics, BPA, and also to use more glass. That may in fact help you get your testosterone levels up. One thing that I talked about a little bit already is getting plenty of zinc and vitamin D. And it doesn't really matter whether you get this from food or from supplements or from the sun. As long as you're getting it, that's the most important thing. So maintaining optimal levels of vitamin D and zinc. One thing you can do as well, and you should be doing this in the morning, is getting 5 minutes of sun. You should get the 5 minutes of sun in your eyes in the morning. That's really important for resetting your circadian rhythm. But there's also some evidence that if you get some sun on your body, it can actually help raise your testosterone levels. So, getting a little bit of sun in the day any way that you can, I think is really important. But again, a little bit separate from this subject, but still on the topic of health, obviously, is if you do get 5 minutes of sun in your eyes in the morning, again, without sunglasses, not staying stare at the sun, it can, in fact, increase your overall well-being and reset your circadian rhythm. It can help you sleep better at night. So I think it's a really important thing to do. I think it'll give you a little bit more energy in the day as well and increase your well-being. And again, Andrew Huberman is definitely the guru on that. If you want to learn more about why it's important to get 5 minutes of sun in your eyes in the morning, look that up with Andrew Huberman. I'm sure you'll be able to find it pretty quickly. Now let's get into some supplements. So I got a lot of these recommendations again from Andrew Huberman and Kyle Gillette, a couple guys that I've mentioned obviously on the podcast here. So one of them is interesting, and this is boron. I want to talk about this one. So this can increase your free testosterone if you have a high SHBG. So again, that sex hormone binding globulin, that's going to bind to your total testosterone and bring down your free testosterone. So if you are someone with a high SHBG, high total testosterone, low free testosterone, and you take boron, then it can in fact increase your free testosterone. So it's going to decrease the amount of testosterone that's attached to your SHBG and thereby increase your total free testosterone, which is going to help with the sex drive, which is going to help with your mood, which is going to help with your energy, your motivation, all that kind of stuff. So again, this will only really work if you have a high SHBG. If you have a low or medium SHBG, you're not going to get as much of a robust response as you would as if you have a high, because you're not going to be knocking off that bound testosterone. So one really important supplement that for people who have high SHBG. But there are a couple others that I want to mention as well. So Tongkat Ali, and before I go that, the doses for boron. So somewhere between about 5 to 12 milligrams a day. And again, there was one human study done on this showing that, in fact, it does increase free testosterone. So we do have studies in humans showing that this effect is, in fact, possible. But coming back to the Tongkat Ali, now that we discussed the boron dosage. So the Tongkat Ali, taking about 300 to 1200 milligrams a day. I know that's a real big range there. So, start off with 300, see how that goes. That's something that a lot of people have found has really helped increase their overall testosterone and their sex drive. So something that I think, should definitely be utilized if you are someone who wants to increase it naturally. Another one you can use as well, this would be the last one on the list, and I'm probably going to botch the pronunciation of this, but it's Fedosia acrastis. I'm not sure if I'm saying that right or not, but the recommendation there by Andrew Hubman and by Dr. Kyle Gillette is to take about 300 milligrams a day for a month, and then to take about 1 to 2 weeks off. So again, just to kind of summarize things, you want to sleep 7 to 8 hours a night. You definitely want to be doing some weight training. Avoid plastics and endocrine disruptors. Get plenty of zinc and vitamin D. Doesn't matter when it's from foods or supplements. If you have a high SHBG, take some boron to increase that free testosterone. Some Tongkat Ali, about 300 milligrams a day, super helpful for increasing your testosterone. And as is Fedosia acrastis, about 300 milligrams a day, but also take 1 to 2 week breaks after about a month. And if you do everything there, you should be able to increase your testosterone to a very high level naturally. Now, what if you've tried all this and things just didn't work out, your testosterone levels haven't improved, and you're still kind of feeling low, and you have low energy, low motivation, and just not feeling yourself? Well, in that case, then it probably is a good idea to, in fact, take prescription testosterone. Obviously, as a doctor, I really, really strongly advise you to get your testosterone from a medical doctor. Okay, you don't want to get testosterone from the street. You don't want to be doing guesswork. You want to be doing blood work. Okay, so if you are someone who wants to get on testosterone, please go to a healthcare professional. Please get blood work done, and please make sure that you take it seriously and that you do it properly, because if you don't, you can in fact hurt yourself. So what are the different ways that men and women generally take testosterone? So I'll talk about men first, and I will talk about women as well. So for men, men generally take testosterone either through an injection, either through a cream. There are some other methods like a pellet. I've never used that method before. I'm not well versed on it, so I'm not going to talk about that today. I'm just going to talk about the ways that I prescribe testosterone. And again, it's basically just two ways. It's either through an injection or it's through a cream. And so with the injection, I only do intramuscular injections. I understand that there's a bit of a craze about, doing the injection sub-Q. I just feel that is unnecessary. I'm not saying that it's a bad method. I'm not saying that it may not even be better than some of the methods that I use, but the methods that I do use, seem to yield really good results. My patients seem to be, incredibly happy using the testosterone this way. And so, that's the way I've used it and gotten good results. And that's what I'm going to, again, be talking about today through intramuscular or through creams. So, intramuscular injections, that's when you take testosterone and obviously inject it into your muscle with a needle. Some people don't like needles, so right away that's just not an option for them, completely understandable. When you are taking a needle, the advantage is that you can get a pretty big, robust response right away because you will be, in fact, injecting the testosterone in a relatively large but safe amount, and so people can get a pretty robust response quickly. That being said, if you do use creams, you can also get a pretty robust response quickly as well. It's just that when you use the injection, obviously you can get a larger response, but sometimes that's not the response that you want if you're doing it medically. So we will talk a little bit about that and dosage and what you should be doing. So, the way testosterone has been prescribed is, kind of crazy in my opinion, and just hasn't been really well thought out in a lot of ways. So, the main forms of testosterone that we generally prescribe are testosterone cyprinate or ethynate, and these two forms of testosterone have half-lives that require injecting more than once every 2 weeks or once every 4 weeks, like it says on the bottle. So a lot of times when people are prescribed these testosterones, I've seen physicians like literally inject like 400 milligrams of testosterone into a patient for 4 to 6 weeks, which is just crazy because they're going to have, an insane amount of testosterone. They're going to feel like Superman maybe for a week or two, then they're going to drift off, and then they're just going to feel terrible at the end of it. So, I think if you're doing intramuscular injections, you should absolutely be doing them at least once a week, but you can use different methods as well. For some patients, you can use it, say, every 4 days. Some patients like to do it every 5 days, and this will keep very, very steady amounts of testosterone. And in terms of how much per week, I don't like going beyond 100 to 150 milligrams per week with my patients. So generally speaking, the highest I'll go is about 80 milligrams every 4 days. And that generally gives people a pretty good response overall, where they're at the top of the range, but generally not over the top of the range. Now, some people may only need to do about 50 milligrams every 4 days or twice a week. And some people find that they don't get that big of a trough, or they don't find that they feel like Superman and then feel terrible if they just take it once a week. So again, once a week, I have lots of guys who take it once a week, and they do find that that's sufficient, where they're not feeling like Superman at the beginning and then feeling terrible the last couple of days. But I do have other guys that did feel like when they took testosterone once a week, they did feel like Superman for a couple of days, and then kind of felt a little bit okay for a couple of days, and then they kind of felt like crap the last couple of days. So for that reason, I do think that taking it once a week or more frequently is important, and that's something that you will have to do a little bit with a trial and error. So I think it's reasonable to start out doing it once a week. I absolutely would not recommend doing it once every 2 weeks, once every 3 or 4, or even worse, 5 or 6. But what I would recommend is, doing it once a week, and then potentially doing it even twice a week or once every 4 or 5 days. And again, always keep your dose about 100 to 150 milligrams a week. That's usually gives people a really good response overall. It puts them at the top of the range without going over. But again, this is just guesswork without blood work. You have to get the blood work done to make sure that you are doing things appropriately. So what if you're someone who just hates needles? You don't want to be injecting yourself every week. What can you do then to increase your testosterone with a testosterone prescription? The other thing that you can do is you can have a cream. So there are some creams out there like Androgel, but there also are some compounded creams. So, I use both. It's really dependent upon the person's overall drug plan. For most people, this comes down to an expense thing. With the compounded creams, the advantage is that the creams are generally stronger. So when they're stronger, doesn't necessarily mean you'll get more testosterone. I mean, it can in some ways, but what it means is that you'll have to put on less cream. So people like that. So with Androgel, for example, people will be using 2 to up to 4 pumps per day. So when you're using 4 pumps of something, sometimes it can be just a little bit much or a little bit tedious for people just because it's just so much product that you have to lather on. So because of that, some people find that, opting for a compounded cream when they just have to put on, 1 pump or a small amount that's very concentrated can be a little bit easier. Where do you apply these creams is actually a good question. So, one question that comes up often is, can I apply it on my testicles? So I do not have my patients apply these creams on their testicles. Now, I am aware of studies that indicate by applying the creams on the testicles, you can, in fact, increase your overall levels of testosterone more than if you put it on other areas of your body, say such as your wrists. But at the same time, overall, this would not be something that has been replicated in the literature, and we don't really know what the long-term effects are of doing that. And we also know that just by applying it on places like your wrist or other places other than your testicles, you can in fact get really good results. So, I'm not like against putting it on the testicles. I'm not saying that, it's something that's not been worked out a little bit in the literature. I'm just saying that I've used creams with many, many different women. We haven't put on the testicles and they've got great results. So I just think it's something that is unnecessary and that doesn't need to be done. So again, creams or gels are a good way. Androgel, lots of people have had success with that. That's definitely one of the more popular commercial testosterone creams or gels out there. But compounded testosterone creams can solve that issue of if you are finding that there's just too much product to put on. One thing I should note about the creams versus the injections is that there is some evidence, small amount of evidence that indicates that when you are taking a cream, you can get a little bit more of a conversion to estrogen or DHT. So just something to keep in mind. So, for someone who's super, super concerned about, male pattern baldness, you may want to consider using the injection over the creams for that reason. But again, not something that, not a decision that you want to take lightly and something that you do want to think about. So those are the main ways that men take testosterone. So I'll move on to the main ways that women take it. So I've never injected a woman with testosterone. They don't need that much testosterone. They just need a very small amount. So how much do I prescribe, for women, versus men? About 1/10 exactly. So when I prescribe testosterone for men in a cream form, I give them 10% testosterone cream. Okay, so they're taking 1 ml of testosterone, 10%, and they're rubbing that on their body, on the wrists for absorption. When I'm prescribing it to women, it's only about 1%. So again, it's going to be about 1/10 of what the man is going to get, which is roughly indicates about the difference between men and women overall in their testosterone levels. Depending on what study you look at, I've seen from about, men have about 9 to 13 times more testosterone than women. So giving them, 1% cream to women, 10% to men. This makes sense. And a lot of women have really benefited from taking testosterone. And so what benefits do they see? They see the exact same benefits that men would see. So they see improved mood, they see improved overall outlook on their life, they see improved energy, improved motivation, libido, sex drive. So, all the things that men experience or that benefit from when they increase their testosterone or start taking testosterone, women will also get those same benefits. And, just like there's a lot less research, unfortunately, on women than there is on men in terms of depression and mood and that kind of thing. We know absolutely for sure, unequivocally, that low testosterone is linked to low mood in men. We do know that more anecdotally with women, but I can tell you from my own patients, again, this is just anecdotal. It's not a randomized controlled trial or anything like that, but I have seen women's health and their overall mood, quality of life improve drastically when they do take a small amount of testosterone. So if you are a woman who is suffering from symptoms of low testosterone, don't be afraid of taking a little bit of testosterone. Make sure you get your blood tests checked and make sure that you do it properly. Again, don't take any more than 1%. Sometimes they even start off just with 0.5%. Sometimes women just need just a little bit to get them going, and then they can just stay there and take that. There's not really any extra risks for women versus men in terms of cardiovascular risk and that kind of thing, but it all still applies. But the one thing that women may have to deal with more than men, that's obviously embarrassing, is hirsutism or unwanted facial hair. And I will say that if you do experience that symptom, obviously you're taking too much testosterone, and the nice thing is that it's never or not permanent. So if you are taking testosterone, you do notice a couple whiskers on your chin or wherever it is that it's unpleasant, just stop taking the testosterone and they will go away. Unfortunately, if you really, really abuse testosterone, and this only applies to women who are taking like large amounts for like bodybuilding purposes kind of thing, you can get that clitoral enlargement, and that unfortunately can be permanent even after you stop taking testosterone. So, there are risks for taking testosterone for women just like they are for men, but again, this is when people are taking crazy amounts of testosterone. If you go to a doctor and just get prescribed enough to replace the amount that you need, then you should be okay, and you should be in a good position where you're not going to experience any side effects. So in terms of what else I was going to discuss today, there's a couple other questions that people had when I did make this testosterone post, and I will address those. So, one of the big things is like, what about testosterone and fertility? If you take testosterone, are you able to have kids? So if you're on testosterone, absolutely your LH and FSH, which is the markers that you're looking at for fertility, those are going to go down. So you are going to be less fertile on testosterone, and you can in fact become completely infertile on testosterone if you take a high enough dose for a very long time. Now, that being said, I've had guys who have taken steroids for 9 or 10 years, and they've had horrible numbers coming to me and basically bottomed out LH and FSH, so no fertility, and also very low testosterone numbers when they got off their steroids. And then I put them on a specific regimen. So it involved Clomid, Nolvadex, and HCG for 45 days. And when I've used this regimen, I've gotten guys restarted within the 45 days. I've had guys even make jokes that even on the 45th day, they got their wife pregnant. They were 1 for 1. So, there are ways, in fact, to increase and rev up your testosterone levels. If you are worried that you have abused testosterone in the past or abused steroids in the past, and now you're infertile, there are ways, in fact, to get that fertility back. Now, if you're someone who is looking to use testosterone, but you do want to stay fertile, you can use something called HCG. So I do have a couple patients who use HCG continuously when they're on testosterone, even if they do not want to get their wife or girlfriend pregnant. And that's because when you use the HCG, it can increase the testicular fullness. So when you do use testosterone, you can get a decrease in the volume of your testicles. They can shrink your testicles. When you use beta HCG, it will restore that for you. Now, I will say that 90% of the guys in my practice do not use the beta HCG. Why? Because it's fairly expensive, and also too, it's pretty tedious. You got to do about 3 injections per week sub-Q. And a lot of people just don't like doing that. So for that reason, a lot of people do stay away from it. That being said, you can use beta HCG while on testosterone and maintain your fertility levels. So yes, it is possible to stay on testosterone and to have good fertility levels if you do use beta HCG. So that's something that a lot of people have asked me about, and something that I understand why a lot of people would be concerned about that. The other really important thing, though, that I should note about that is that if you are taking testosterone, please do not use it as a form of birth control, because lots of guys who use testosterone, it's been estimated up to like 30% or even more, are still fertile. And you probably have a bodybuilder friend or a friend who's abused steroids who did end up getting, his girlfriend or wife pregnant. So again, guys, if you are using testosterone, please do not use it as a form of birth control, because it really is not that effective as a form of birth control. So in terms of other questions that people have, going forward, they've asked me also about, cholesterol levels, which I also addressed earlier in this podcast as well. So if you are taking testosterone, absolutely get your cholesterol levels checked. If you take too much testosterone, it can negatively affect your cholesterol levels. So make sure that you get those checked as well when you are taking testosterone. Another question people have, what ancillaries do I use, or do I use anything besides testosterone when I'm prescribing testosterone for patients? So, like I said, sometimes I will use the beta HCG. In cases where people are coming off testosterone, then I will use the Clomid and Nolvadex. But again, going back to what else to use when people are on testosterone, I rarely use Arimidex. I really do not like using Arimidex. So Arimidex is an aromatase inhibitor. So what that's going to do is that's going to inhibit the conversion from testosterone to estrogen. So, why don't I like using that? Because it's so powerful that it can bring down the estrogen levels almost too much. And unfortunately, they're just made in large doses. They're usually in 1 milligram doses. And even if you can cut it in half, it's 0.5. It's still pretty strong. So if I use it at all, I try to get my patients to cut it in a quarter, which again, I still don't like doing that much, because it can negatively affect your cholesterol levels, and it can negatively affect your liver enzymes as well. So I don't like using Arimidex that much, but I'm not saying that it has no utility. If someone does have, really high estrogen, taking a little bit of Arimidex is going to smash that down quickly. So, it definitely saves guys from gynecomastia and that kind of thing. So it does have its utility and its uses, but I just don't like using it long-term on a continuous basis because of its effect on the lipids and cholesterol. So, I try not to prescribe that too much. One thing I do use, some people find this a little bit unconventional, but I've gotten great results with it, is progesterone. So progesterone for men, you usually hear progesterone for women. But a lot of times men, when they use the progesterone, it's only, again, a very small amount, about 10 milligrams. To put in perspective, a lot of women are taking 100 to 300 milligrams, so only about 10 milligrams of progesterone. And what does that do? It can in fact inhibit the conversion from testosterone to DHT, and it can inhibit the conversion from testosterone to estrogen. So it kind of kills two birds with one stone. It can also be fantastic for helping you sleep at night and for reducing overall anxiety and improving your mood. Progesterone is known to help women sleep at night, and it is known for improving mood and overall anxiety. And I find that a lot of my patients who have used progesterone have found great results with it for improving their mood. And some have said that it's really helped with treating their hair loss. So definitely a hormone to consider when you are on testosterone is progesterone. So that more or less concludes what I wanted to chat about today. Thank you so much, everyone, for watching this episode. I really enjoyed doing this solo podcast. Obviously, I enjoyed chatting with guests, and I got some really great guests lined up. So I'm really happy to be sharing those episodes in the future. But I really like doing this episode today on testosterone. If there's any other topics you guys want me to cover, please let me know, and I'll absolutely do an episode on that. Thank you so much, everyone, for watching. Again, if there's any other questions on testosterone that you have, please drop them in the comments. I'd love to come back and do a part 2 or even a part 3 or get another guest come in and we'll talk about testosterone. So I'm definitely going to be revisiting this. But again, thank you again, everyone, today for listening. And as always, I'll be back again soon.